Welcome to Dr. Saying Stuff, a place where we chat about topics you probably Google, so skip Google, come straight here instead.
We're more fun, and our videos are way easier to understand. Or at least I hope so.
I'm Dr. Jay Rutland.
And I'm Dr. Alok Patel. Today we're talking about intellectual disability, which is a very broad term that a lot of parents and patients ask me about. But it's not that uncommon. According to the NIH, about 2 to 3% of US children have some form of an intellectual disability.
Alok, you're the man, but you're not an expert in this area.
I'm not, it's true.
So who do we have joining us today?
We have the one and only Dr. Kristen Sohl, a pediatrician with a ton of experience and expertise in the medical diagnosis, evaluation, and treatment of children with several different behavioral or developmental disorders. Dr. Sohl, thank you so much for taking the time to be here.
All right, Dr. Sohl, first question. How do you define intellectual disability?
So intellectual disability describes people who have differences or challenges in intellectual functioning, typically defined as communicating, learning, and problem solving, as well as adaptive behavior. So adaptive behavior, that means everyday social skills, routines, and hygiene. When we think about intellectual disability, there's quite a range of people who might be labeled as having intellectual disability. But those two important pieces are critical for that diagnosis.
And how does the diagnostic process work? Is there like a set criteria, a screening process?
Intellectual disability is usually diagnosed through testing. So there are tests that look at IQ, or the intellectual or intelligence quotient, and this measures a person's ability to learn and problem-solving skills. The average IQ, or intelligence quotient, is around 100. Children with intellectual disability, or ID for short, have a low IQ score, most commonly between 70 and 55. Depending on the score, can often help predict the level of support a person with a lower IQ than average may need. It's important to understand that intellectual testing or intelligence quotient testing, IQ testing, really isn't supported below the ages of 4 to 6 years of age.
And I know it depends on the individual, but can you give us an example of how you diagnose and how you treat intellectual disability?
Typically, an intellectual disability, or ID, is diagnosed through a psychologist or sometimes the school. The school is often looking at ways to help that child succeed in the classroom environment based on their IQ score during IQ testing. When we think about treatment for the diagnosis of intellectual disability, it's important to understand that there is no cure or there's no treatment for someone who has a different intelligence quotient or who has an intellectual disability. But what we do know is there are lots of ways for that person to thrive and to succeed in their environment. And that's really the important focus of treatment or supports and services, as I prefer to call them.
Dr. Sohl, there's probably some parents out there watching who have a lot of questions that we may not be able to address in such a short time. Where should they turn? What's a good resource for parents out there to read and learn more about intellectual disability?
So if you're a parent and you're listening and wondering if there could be an issue with your child's intelligence or adaptive skills, seek that guidance. Talk to your pediatrician. Help them understand some of the things that are on your mind, making sure that you're connected to your school district, whether your child is over age 3 or under age 3. Every state in the United States have access to supports and services for kids that may be having differences in their development. Get that help now so that your child has the ability to grow and to develop into all of the ways that they're excited and that you're anticipating.
Dr. Sohl, thank you so much for taking time to chat with us. We love chatting with experts such as yourself. We know that you don't have a whole lot of time on this planet, but we appreciate the time you spend with us and with children and their parents to help along the way with their diagnosis of intellectual disability.
And an important note, if you or someone you know gets diagnosed with intellectual disability, this doesn't necessarily mean what's going to happen in 5, 10, 15 years. It depends on the individual, and it's important to ask a lot of questions. Because there are people who have a diagnosis of intellectual disability who are still able to go and live a fun, productive, high-quality life. It all depends.
It's all about getting the right information and getting the help when you need it how best you can get it. And we really appreciate that because we're all in this together. We're going to see you next time on Dr. Saying Stuff. If you have any other questions about medicine in general, any new topics you want us to discuss, leave a comment, leave some feedback, let us know. You can even Instagram or TikTok us and let us know as well, right, Alok?
You sure can. Holler at us by all the different mechanisms.